Hi. First of all, I really want to thank you on behalf of your pets and on behalf of your family that you come here, spend this 1 hour or slightly more um, to learn about your pets, um, not not bringing too much of a benefit to yourself, but for your pets. I'm really proud of you guys. Hi, everyone. Thank you. Hi, Rohana, Mandy, Wendy, Rini. Great. We'll let others to come in. We'll give them maybe about 1 or 2 more minutes. But as they're coming in, I would really want to take this opportunity to introduce you who we are. A lot of new friends around today. Great. Joey, can you put the PPT up? Right. This is us. We are PetMedic. We're the Malaysia first pet first aid academy. Other than first aid, we do also try to educate pets owner in different medical knowledge. For us is we're very passionate and knowing that pets parents are actually the most important person for the pets that we're treating. So most of us, we always think that, vets and pets relationship, but we always believe that a very good parent, a very good pets owner that very knowledgeable, not only good, I know all of you love your pets so well, but very knowledgeable pets owner that know more about their pets medically, their health and nutrition and all the other things would actually give them a much more better living condition. And therefore, we will achieve what we want to achieve as a pet owner, which is, I think all of us, including me and you, the same, that we want them to spend, as long as they have with us, in a very healthy way. Okay? If any one of you agree with what I say, please type in 99. Okay. Why do we like 99? I'll probably keep asking you to type 99 later on. Why do we love 99 is because 99 in Mandarin is called forever. So 99 symbolizes forever. We want our pets, stay with us forever, whether physically or in our memories. All right. It's 3 minutes past 8:30 now. I think all of us are ready. If everyone is ready, can you please type ready for me? Okay, I know all of you are quite new here, but the way we want to learn is that we always want engagement. The more you answer my question, even though you don't know what you're answering, even though you're giving me the wrong answer, it's fine because as you are communicating with me, as you're engaging with me, the more you will retain after the class, okay? Great. Great. All of you are ready. Now, I want to tell you a little bit about the background of why we are doing this particular class. I have been sharing this with the PetMedic members actually somewhere last year and half a year ago. But why we actually now share with the public as well is because there are so many of us pet parents are diagnosed positive with COVID. And many of them don't know what to do. And many of them, call for help. And many of them doesn't do the right thing that cause other people to have problem. So that is the reason why we're having this class. Okay, let's do it. I will try to finish the content that I prepared for you guys for today. And then whatever question that you have, please put it up in the chat box later. And then if it is really relevant with what I am going to discuss later, I will bring it up straight away. Or if it is not that relevant, with what I was talking about at that time, I will leave it to the end of the session to answer you, okay? All right, let's start. Okay, first, what is virus? Who know what is virus? Tell me what is virus. Come, type in the chat box. Tell me what you know about virus. Anything. Okay, we have to keep this going. Come, even if I have two answers, I will start. A disease, a bacteria, a pathogen, a germ. Right. Okay, great. I'll give you a real description about what virus is. And why do we need to do that? Because we want to know who our enemy is, then we can actually fight them better. All right. So what is virus? Virus is not even a living thing. Do you guys know? They're not really a living things? They're actually just tiny protein coded stuff, which actually have, very, very simple composition with some DNA or some RNA being wrapped inside a protein code. And then they cannot even replicate, by themselves because they are not a living thing. So what they need to do is they need to find a living cell to replicate. So we want to grow the virus. We always say we want to grow the virus in the lab. So why we're growing the virus is because we give them the cell bait to grow inside so that we can study them better. All right, next. So next, Joey. Okay, viruses are very special. I need you to understand this. Virus always attack or replicate in the cells that they actually have the receptor. So the virus is called the antigen, which is the key. And then the cell, whatever cell that we have, is actually the receptor. Only this certain virus can actually attack these certain cells. It is like a key and lock system, okay? Key and lock system. Only get the right key, you can open the lock. If you get the wrong key, you don't open the lock. As simple as that, okay? Meaning to say that virus doesn't really replicate in any cell that they like, okay? They only do particular cell. The same thing goes to antibody, okay? Why, when we have coronavirus, we need to inject coronavirus vaccine? Why? Because only coronavirus vaccine that looks like this coronavirus come into the body and we make this antibody. When we make the antibody that actually looks like the shape of the receptor, then we can bind with the antigen and then take care of it, okay? That's how this antigen antibody works. I'm not talking too much about it, today, but this is a concept that what you need to do. So you need coronavirus. What is coronavirus? Why is it called coronavirus? Next. Okay. The simple term of why we call coronavirus, Joey, you might want to go to the slide before. Why do we call coronavirus? On your left is how the coronavirus look under the electron microscope, okay? And the one that you see that very beautiful looking is actually just a drawing from it. And why is it called coronavirus is because it looks like a crown, okay? And corona sounds crown, okay? Coronavirus is a large family of viruses, okay? I don't know whether you remember. It caused a lot of things like a cold-like thing, cold-like diseases in animals, like cattle, camels, or bats, okay? And definitely we have how to say feline and canine coronavirus? Joey? Okay, this is how the protein on the virus look like, okay? And under this shell is where inside the capsule, inside this protein capsule, is where the DNA and the RNA is, okay? That is the DNA that actually will start infect people and replicate inside the cell when they goes into the human body, right? Next. So this is a virus of, you know, a very large group of viruses. And this group of viruses is actually a capsulated virus, okay? It causes in human, some of them cause little disease, some of them, you know, very mild disease. And mild disease in human, like the common cold, but a little disease that you guys, you know, might have heard of is like SARS. Many years ago, we actually have SARS, MERS, and COVID, okay? In cows and pigs, sometimes they cause diarrhea. You know, some of them cause rats or mice that have hepatitis or encephalomyelitis, is the brain diseases. Okay, next. These are not that important. I'll just bring it over. Whoever that, yeah, Siti, I hope I answer your question. Why is it not a living thing? Okay, next. Okay, this is what we want to concentrate on, okay? I assume that most of you have cats or dogs, and we are going to concentrate on feline and canine coronavirus, okay? Do you know that it has been in our pets for a very, very long time, this coronavirus? If you have noticed, if you can see your vaccination card now, right, whoever that get vaccination for their pets, you might find coronavirus inside your pet vaccination card, because we do vaccinate, you know, doggies with canine coronavirus, okay, in dog vaccines. It doesn't usually cause a lot of serious disease. Most of the time, they cause vomiting and diarrhea. And most of the time, it causes very, very bad disease in very young animal or very old animal or immune suppressed animal, okay? And then cat coronavirus is bad. Okay, I'm going to talk a little bit more about cat coronavirus. Why? Because if you understand a little bit more about this cat coronavirus, you will understand this COVID a bit better. Who among you here that have heard about FIP? Whoever that heard about FIP, or you know, your animal has or your cat has actually unfortunately have this virus before, let us know in the chat box. Only one person, Angela. That's very good, because it's a very bad virus, okay? So I hope none of you or, you know, have this, but you must learn about this. What is FIP? Is actually a coronavirus. You know, a test that I have run maybe about almost 16 to 20 years ago, when I was a student, a vet student. I've actually run about 100 samples from these FIP cat that stays in the same catteries with a lot of other cats. All right. So long story short, this FIP is a deadly virus that's incurable. Okay, it's incurable. So Angela, I'm very sorry to hear that. Angela has 2 cats that passed away due to FIP. And very agonizing is because FIP is actually an incurable disease. It's in a way incurable as in whatever drugs, but we can talk about that next time. But what happened is this coronavirus can go inside the body of the cat at any time, any point of time. So what I did was, whichever cats that we have to take as a sample, that cattery that have one cat that die of FIP, I will test like 10 cats in their catteries that looks very normal, very healthy, eating very well. Out of the 100 samples that we get, about 90 over percent of them are highly positive for coronavirus antibody, very, very highly positive. But none of them, out of the 100, none of them are sick. And why does this cat sick and die? Is because this coronavirus inside their body, they start to mutate. The word is mutation. Okay? They start to mutate, and when they start to mutate, they cause this deadly disease, which like how you see it now as COVID. They mutate, they make a very serious disease and very fast most of the time, and it's incurable, and then they die. And then the cat die. Okay? Next. I just want to remind you guys, because not many of you guys know what FIP is, you can actually take this FIP down. It's called feline infectious peritonitis. Okay? And study about it later in Google. Okay? Read about it. It's a very interesting disease, very interesting virus, but it's very deadly. All right? COVID-19, last year when this COVID thing, started during early of 2020, not many people know about this COVID, okay? And COVID-19 was actually being called a SARS look alike coronavirus 2. It's called SARS-CoV-2, okay? This SARS used to kill many people as well. So at that point of time, SARS is being told as transmitted by civet cat. Okay, and this MERS is transmitted by bats and then goes to camel. Okay, they infect these different animals. So the initial story at early 2020, everyone thought that this COVID-19, which is also a coronavirus, must have come from animals. So everyone is like, oh, damn animals. So everyone, some very, very worried pets owner that doesn't love their cat or dogs that much, start to, push their cats and dogs away, which is very sad because they do not understand this virus. And this is the main reason why this class is being conducted today. Okay, so that is initially what is happening. So by the time that, when this COVID has run for more than a year now, and we have been survived in this pandemic for more than a year now, we know a lot more about this coronavirus. Even though now we have new, Delta variants and other variants, why we keep having these variants and why is this thing keep happening is because coronavirus can mutate very, very fast. All right, next. Well, you don't listen to me, okay? Whatever that I say, I do research and then I take data from CDC as well, from other medical journals, and it's also reputable university that actually comes out with all these terms and technical stuff. So today I'm going to give you a lot of technical stuff. Don't worry about it. Just pick in and write down whatever that I say that you don't understand, and you can ask me about it later. Okay? And you can also Google it later when you want to know more. Okay? So according to the US Center of Disease Control and Prevention, we call it CDC, a big question. Can your pets get COVID? Come, tell me the answer. Can your pets get COVID? Come, too much to digest now. After 20 minutes, everyone goes crazy. Thank you. Thank you very much. Very good. Okay, the very short answer, a very short answer is no. Don't know, that's why I'm here. Thank you so much for being very, very frank with us. Okay. A short answer is no. Then you say doctor. You say no, then you say in your post or in your website lah, or in your Facebook. Why do you ask us to come for this class? Because the answer is short as no, but there's a lot of things that we need to tell you to make sure that your cat or dogs are safe. Okay, the short answer is no. Right, next. So according to CDC, cats and dogs don't really get virus, this COVID-19. But you must ask me, hey, but I heard there are reports from Korea, reports from Hong Kong, reports from other countries that the animals tested positive. Like, doctor, you're lying. Okay, most of these pets that actually tested positive, that they are infected is because these pets have very close contact with the people who is infected with COVID-19. Now, everyone like you scared. Hiya, say, now I'm already positive for COVID. How? And my dog and my cat is with me. How am I going to pass this to my dog and cat, and my dog and cat will be die? You know, if they kena COVID, no. COVID-19 mostly spread from person to person, okay? But it can also spread from people to animal, like how you, okay, I'll make this very simple. It's something like how you spread the virus to your water bottle, to your handphone, to your bags, when you sneeze on them. And when you touch your nose, that you actually, have the virus, and you touch on other surfaces. That is how you kind of transmit the virus. Okay, so what did they do? So usually they will stick on how they actually find out, not from postmortem and all that. They actually find it on the mucosa surface, like the eye and the ear, and the eye and the nose and the mucosa of the animal who their pet's owner are COVID positive patient. Next. So now, in the beginning of time, when this COVID started, everyone are worried about these pets. When they get COVID-19, they will spread from one pet to another, and they are spreading from dogs and cats to human. Okay, there are none of these things that being reported. Okay, they don't play any significant role in spreading the virus. Okay, that causes COVID-19. No evidence. There's no evidence of viruses can actually spread to people or other animals from even their hair, their skin, or their fur. Okay, but bear in mind, they can actually carry the virus. If you really are positive yourself, you keep kissing and you keep playing with your pets, and then, you sniff when you hachi, you actually, sneeze on them. And then you're very happy, you now can get your RTK and all that, right? Then you try to swab and actually swab them and then test them. You might get a positive, but it doesn't mean that they actually come down with the disease. Understand so far? Yes. Owners, please get vaccinated all the time. No, you don't have to swab test your animal, please. They hate being swabbed, so please don't do that, okay? Now, I want to tell you next. I will try to go through as fast as possible. Then I leave some time for you guys to ask me questions. Yeah, I know there are a lot of questions in your mind that you want to answer me. The same thing. No, if the virus actually, let's say we actually sneeze and actually goes to them, from their saliva to other cats or their saliva to this another human, there's no evidence of the cats and dog can actually pass the virus in that way. All right, no report at all. Okay, but because there's no evidence of this, but if you have a very young children and very old people and immune suppressed person like HIV patients, like lupus patient, please do not hold the dog when you're positive with the viruses, you know, play with them and then let the dog goes to the other person. Okay, it will actually, our virus can actually stay on them if you don't sanitize them properly, but to the immune suppressed people, there's not enough data yet to tell that nothing will happen. All right, next. Now, the best thing that I want to tell you today, do you know that your cats and dogs need to distance as well, need to keep the social distancing as well? Okay, why I feel there's a need that we do this is because many people, you know, when they even goes to the park, sometimes now they still bring their dogs to park. Okay, it's probably not a very good idea because you don't go out during MCO. Your pets try not to go out as well. If some of the dogs really need to pee outside the house, just go outside, pee and poo, and come back. Not to go around the whole neighborhood. Try not to. Okay. Social distancing still need to be done. We usually CDC actually recommend a 2 meters, a 6 feet distancing. All right, if you can, you keep them indoor. Those cats that like to roam outside, try not to, keep them indoor. If you really need to wash them, really need to walk them because you know they don't pee and poo at home, you walk them, but you clean them with soap or even sanitize them before and after the walk. Before probably, you know, not really, but if you can have a sanitizer that actually can sanitize them and prevent them from getting viruses or kill the virus when they get contact with them, and then when you come back, wash with soap, but make sure you dry them properly. Some of them, you know, have a lot of hair on the paw. If you walk them and you keep washing them right on the paw and you don't keep the paw in between the paw dry enough, it will actually cause other problem like fungus or bacterial infection. Okay, sanitize them and then also sanitize your environment. Okay, later on I'll cover what to use for sanitization. All right, a lot of people use things like essential oil, ozone, or some use water or use Dettol. Okay, next. Okay, you try not to bring them to public places. Okay, don't walk them in the park anymore. If you really walk them, please make sure you keep them on leash. Okay, and keep indoor as much as possible. Next. Okay, now what do you do if you get sick with COVID? Any one of you here are unfortunately being diagnosed as COVID patient? For the past 2 to 3 weeks, I at least get about more than 10 calls from pet owners that actually positive, being diagnosed positive as COVID, right? And they do not know what to do with their pets. Okay, like how I tell you, and now you understand the virus so well, and you now know that they don't replicate in the cats and dogs body, and because their key and lock is not that fit compared to a human being, they don't replicate as much and they don't cause diseases in dogs and cats at the moment for this particular COVID-19 after mutation. All right. So what do you do next? First, definitely you have to isolate yourself lah. All right. Whether you like it or not, you yourself have to quarantine yourself. If you have someone to take care of your pets, please isolate yourself from your pets too. Okay. The other day, someone called me. Only mother and daughter and the dog. Okay. Both of them are diagnosed positive. And what happened to the dog now? So they call, they're really, really worried. Then they say, no, dog, cannot. Should I send the dog away? Now that me and my daughter are positive, we're very worried. We cannot send. If we send, can we get a pet taxi to send? Please do not do that. Okay. If possible, in your household, let's say you don't have to send them away, in your household, please isolate yourself with them. Why you don't send them away? First, because they might have already, on their surface, have some of your viruses already. That's one. Okay. So if you really need to send them to someone or nearby or next door, or your daughter or whatever relative is next door, if you really want to do that, you can actually sanitize them, but you don't have to. Okay, don't have to. Because sending them away, I'm more worried about the pets than you do, because when you're sending them away, especially cats, some dogs as well, they get really, really stressed because of this familiar environment. They would even hold their urine and hold their poo-poo not going to toilet. Which cat owner can actually resonate with me? Stress. If you can resonate with me, put in the chat box, say stress. They will be so stressful, even, go out to, go to their sandbox to pee and poo. And you will end up with a lot of different problems, after that. Okay. Thanks, Meiyan. Who else? Not the other owner, that their cats won't get stressed out. All right. Avoid petting. I know you love them. But try not to snuggle with them, kiss them or share food or share your bed with your cats anymore, just for that 10 days, okay? Because during the 10 days of you really being positive and during the recovery stage, you are actually actively shedding the viruses as well, actively. Sneeze and all that you have might actually, spread the virus to them. Joey, can you mute whoever that needs to be mute? I'm sorry. Can you guys please help to mute your... I need the previous slide. Okay. If you care for your pets around the animal while you're sick, so if you don't have anyone like the daughter and the mom and daughter, so what you do is you wear a cloth covering or mask when you are washing them, and then wash your hand before you actually handling them. Wash and sanitize your hand, but make sure if you have sanitized your hand, right, if you are using an alcohol sanitizer and you know that your dogs and cats likes to lick you, try to wear a glove so that they don't directly lick your sanitizer. Because within this pandemic time, we also see many cats and dogs that come in with asthma and even alcohol poisoning because they have been licking or get exposed to their human sanitizers. Okay, even whether it's the house sanitizer or environmental sanitizer, and also the hand sanitizer. All right, make sure you clean up after your pets. That means after they poo, after they pee, you clean it up and then throw it well together with your glove and all that as well. Okay, next. Okay, what if, what if your pets are sick and you are diagnosed with COVID? Who can tell me this? This could be a very interesting question. Tell me if you're positive. Now that you know the virus, now that you know how it mutate, now you know that you know how it goes to the other pet, what will you do if you are positive with COVID and your pets are sick? Come, tell me before we talk about disinfection. Anyone? Please. No one can answer me. Now I doubt whether you guys were listening just now. Isolate ourselves from them. No, now that your pet is sick. Thank you for answering me. Danu, thanks. Chichi, vet boarding. Send them to, oh my, call the vet. Okay, thank you, Susan. Please call your vet. Please call your vet. Human and pet stay in separate room. Thank you very much. I think Suen and okay, thank you. I think these people are paying attention. Right. You guys have spent your time here. Please pay attention so that we can do this in a very good way. Minimize contact. Now, you are sick. You definitely have to quarantine yourself, but your pet are sick too. So what do? You don't send your pets to the vet because you need to quarantine. I know that you'll be so worried. You will be so worried about your pet, but you're positive. Please remember, as a person, as a responsible citizen, if you are positive, you don't go out of your house. So if your pet is sick, suddenly diarrhea, how? Call your vet. Call your vet. Well, you can ask your friend to bring your pet to the vet, but it's good if we can, teach you to sanitize your pet a little bit, get your friend to also sanitize the carrier, put them in the carrier. Okay, let me rephrase this. Call your vet first thing, okay? Tell your vet that you are sick with COVID. Second, please write this down. Tell your vet that you're positive with COVID. How many days already that you have been diagnosed? Okay. Then third, tell your vet your pet's condition. Do like a telemedicine. I know telemedicine for vets in Malaysia is not really allowed, and to be very frank, as a vet, we're not supposed to do telemedicine, but we are not going to, tell other people. So many people think that telemedicine is not right, but in this particular sense, you need to get a teleconsultation with your vet. Tell your vet that you are sick with COVID. Thank you so much, Siti, for actually put this up to help other people. Thank you so much. Tell your vet your condition. Third, tell your vet your pet's condition. Get some videos of, let's say, coughing or diarrhea or vomiting or urine blood, all these things, so that tell your vet your pet's condition. What is the sickness? How it is? Put it very nicely. We will know that you are very scared, but put it very nicely. Tell your pet first the information that you need to tell your vet. First, your pet's age, sex, and what is the condition, whether they have neutered or not. Number one, age, sex, what sickness that they have, whether they are neutered or not, and the breed of your pet. Why so? Because this is very important. All of this information is very important for us, the vet, to actually be able to judge, what, at least, what is more probable. And all these things are going to help us to triage your pet's condition. What a triage means is to see that whether it's going to be a life and death situation. It's like, oh, you actually video your cat that cannot breathe properly. Okay, normally your cat will just like lying down properly, sleep, and suddenly one day you see your cat sleeping, but it's like breathing like that. Chuck out the tongue. The tongue is pale. You video that and send to your vet. Okay, video and picture paint 1,000 words as well. Give that few things to your vet and video those condition. Say if they're not walking properly, limping, take a video and show your pet. Show your vet. Okay, if it is limping, get a video walking towards you and away from you, so that they can see the front leg and the back leg. They will probably tell you what to do. But the whole idea is to actually tell your vet all this so that they can triage the situation. Then they can tell you, oh, vet, it's very pale and all that. You need to get this pet to the hospital. So then you can actually get one of your friends or whoever that can help you to put your pet. If you can, sanitize your pet a little bit. I'll tell you, maybe just wash your, okay, if you don't have sanitizer, what do you do? If your sanitizers that friendly for pets, you use the sanitizer to actually sanitize your pet's coat. If you don't have sanitizer, what you do is that you can actually just wipe your cats or dog with very mild soap, or even just water, just clean them out, wearing glove, put them into the carrier, sanitize the carrier. The carrier, you can use sanitizer. Later on, I'll tell you, any chlorine-based, formaldehyde-based, or even alcohol sanitizer on the carrier, not on your pet, on your carrier. And then you can pass it to your friend, or you put outside your door so that your friend can pick up from there. Okay, and when they actually do that, your friend, make sure doesn't get close contact with you. Also bring to the vet and actually tell them, the vet, to tell them that it's coming from a close contact person of a COVID. So the vet will also kind of help to sanitize your pet. For video call, right, Siti, I would just help you a little bit. Make a video, but try not to do video call, because we realize that when we do video call, as you're moving your camera, as we are seeing the pet, we might miss quite a lot. So you video the pet's condition and send it probably by WhatsApp or email or anything like that, whichever your vet's condition that your vet use. Okay, sanitize the carrier and then bring to the vet and let your friend tell your vet that this animal has close contact with a COVID patient. All right, then the vet will help sanitize the pets before they see, and they will be very careful, wearing gloves and whatnot. Okay, with this, you are helping your vets too, and you are doing a very good citizen responsibility that not spreading this COVID virus. All right, so far so good. This is what you do when your pet is sick, because when your pet is like not so sick, that let's say a small cut of wound on the paw, or that's interdigital cyst. Let's say your dog lick the paw, and then there's a cyst that comes out and then it bursts. But for you, it's a big thing. Wow, it's bleeding all over. You'll be shouting like crazy. Oh my dog is bleeding non-stop. But when you actually show your vet, they probably know that it's actually just a cyst in between that actually caused the bleeding. Then they will probably teach you how to actually clean and disinfect, and then bandage the paw up so that you don't have to come to the vet. All right, help yourself, help the vet. All right, great. Anyone understand? Thank you so much. Wonderful city. Thank you so much. Okay, next. Everyone can follow so far? Any question? If everyone can follow, please put a 99 for me. I need some energy. Oh, I have 15 minutes more. Thank you. Thank you. Now, I'm going to do something very bad for you guys. This is not to confuse you guys. I know there are so many disinfectant products in the market. So many. Okay. I just want to tell you as a scientific perspective, and that is why you come to this talk, because you want a proper information, right? So we must give you data and proper information. So as you can see, this whole difficult looking tables, all right, you can see all the things up here is actually the compound that we use to sanitize our environment, our pets, and all that. So later on, I'll tell you what is more is safer, or which one is more suitable for environments. Okay, you can take a photo of this, or you can even go to Google and Google this out. Okay, so this chemical disinfectant, first of all, you have to always clean up the soil. Okay, let's say there's poo-poo, there's pee-pee, there is sand, there is mud on the paw or in whatever area. Clean those organic matters out first, or clean the dirt out first, and then you use the disinfectant. Then it will be more useful. All right, your environment, where your pet sleep, where your pet bedding, your pet cage, always make sure you remove all the organic materials and all the dust and dirt first. Okay, so from acid, alcohol, aldehydes. Okay, this is too many words to tell already. I will just highlight a few things. So what is COVID? COVID is a coronavirus. So coronavirus is actually an envelope virus. As you can see on your left side, there's this envelope virus and non-envelope virus. Okay, so for COVID and coronavirus, they're actually envelope virus. Okay, so you definitely have mycoplasma and all these different bacteria. You have gram-positive, gram-negative. Don't have to be really paying attention to. But these are generally the group of things that you can use, and is quite effective for us. All right, envelope virus. Thank you, Joey. Okay, next, I'll show you the next, and then I'll highlight a few things for you. Next, Joey, that's another diagram, right? Nano silver spray, it's actually Collider silver, is actually not really categorized in this chemical disinfectant, because they are not chemicals. So to be very frank, because there are no publication that I can pick up on from this that I can use to tell you, I probably wouldn't be able to answer your question, Susan. All right. Why am I picking this up is because this one, this group of disinfectant is something that we can actually already have a lot of study that done before. All right. There are some that actually gets fungus spores and other bacteria, non-so bacteria like Coccidia and all that. Okay. Leaking sanitizer made of nanosilver shouldn't be a problem because they are not really chemical. But how much of effect that is being produced, I can't tell. Okay, I'm not saying it's not good, but it's just that there's not something that heavily back up that I can tell here in the class. All right. Next, okay. Next, I think I have summarized for you some of it. You know, when you go for when your cats and dog go for surgeries, or I'm not sure whether you have any wound or any lesion before that you go to your vet, and your vet give you this pink color solution. Okay, this pink color solution, do you know what name is that? Okay, let's discuss the property of some really good ideal disinfectant. Okay, it has to be broad spectrum. Broad spectrum mean, like just now, take care of a lot of bacteria and viruses and all that. It has to be fast acting. So usually fast acting means like alcohol. Why CDC have to let us get anything that is alcohol? So first, before this KKM can approve any other sanitizer, KKM just says any sanitizer that has more than 70% of alcohol is being approved as a proper sanitizer for human. Remember? Long ago. But I think about half a year ago, they have more data to play with. That's why they also approve other non-alcoholic sanitizers. Okay, so if you see, previously it's only alcohol sanitizer that's being approved. Why? Because they kill viruses almost instantaneously. It's about, you need only to have contact time for about 1 minute, and most of the time they kill the virus already. Okay, it has to be fast acting, about 1 to 10 minutes. Some of the properties will need to live longer. I'll tell you about it. Okay, not affected with environment factors, meaning too hot, too cold, too humid. All this shouldn't affect this sanitizer effect. Okay, and it's not non-toxic to your to human or even pets. Okay, so it depends. So when you really use on your pets, you use the one that is friendly with pets. If you actually use on your surfaces and all that, you can use those that is for the environment. Okay, residue effect means after you have cleaned and sanitized, how long can this sanitizer work and how often you need to do it. Okay, most of the residual effect of the things that I have shown you, like aldehydes and chlorine base and this halogen base effect should last about 10 to 12 hours at least. So you have to probably do 2 times a day if you can, or some of them actually you need to do 3 to 4 times in a day. Okay, next. Easy to use with clear label direction, odorless. Okay, all these properties of ideal disinfectant I actually copy from CDC. Okay, why am I doing this? Is because I don't want to say what I want to say. I want to say what the authority and scientists actually have gathered information upon. All right. Solubility, it has to be soluble with water, stable, and you can actually have cleaning property, and is the best if it is environmental friendly as well. Okay, next. So the disinfectant that's out of the whole tables, right? I've actually summarized some of it that is more animal friendly that we usually use in the clinic, in the farm, and also at home. All right, next. So most of it, like in environment, chlorine based. I'm not sure whether you have heard about it. You actually have chlorine tablet. You have Clorox. Everyone, I think, know about this. Do you know? Do you know Clorox and all that? City say don't know the name. What name that you do not know about? This chlorine based one, very famous brand called I think it's called Germicide. Okay, I'm not related to them. Shouldn't be calling brand name. Oh, the pink thing. Okay, the pink thing is something else in the list. I'll talk to you later. So chlorine base is actually like the most easier that you can get is actually Clorox. Okay. For Clorox, what you do is if you don't have anything but you have Clorox at home, actually it's a different school of thoughts. In very, very old days, the dilution has to be 1 part of Clorox to 30 parts of water. Okay, like it actually wrote 28, 1 to 28, but 1 to 30 parts of water is quite of a older researcher. That's where it works. Can you write it down? 1 to 30. So now even 1 to 50 or 1 to 100 works quite well already. But you need the contact time. So after you mix, right, you spray it around the environment, not on your pets, yeah? On your environment, your dog cage, cat cage. So like just now, someone told me that your cat actually passed away by panleukopenia, which actually it's like doggy parvovirus. So those actually you need to actually spray the cages and all and leave it on for 10 minutes. Leave it on for 10 minutes before actually they have this killing effect. All right. If you're very worried that, you know, after you spray the Clorox mix water, you worry that your dog will go and lick it. I don't know how they like to lick things everywhere. So after that 10 to 15 minutes, when it's all air dry, you can actually mop 1 time or clean 1 time with plain water. Okay. So remember just now, like what we told you, we say that the good properties of the disinfectant is that after you sanitize, you actually can still have this protection film, protection layer. Okay, this is how it is. Okay, you can use Dettol. Dettol for certain viruses. For certain viruses, Clorox mix might be more effective. Okay, you can go back to the table that I show you just now. Is really not. I'm sorry that I couldn't really comment on brand basis. So what you do is I give you that table right just now. Later I can actually go back and then you take a photo of it, and then you can actually try to find out what Dettol active ingredient is and what Clorox active ingredient is, and look back to the group of things that I'm showing you. Okay. One Clorox to 10 parts of water is too strong. Try not to, City. Use 1 to 30 maximum already. Okay. 1 to 30. Otherwise, it will be too much. And not only the cat will get very sick, the human will get very sick too because it's too smelly. All right. And then the second category is called the aldehydes. Okay. You have formaldehydes, glucoaldehydes, and all that. This is something that usually in the bottle, they will tell you 1 parts to how many. Okay. How many ml. So usually some of the formaldehydes, they will put it as 1 to 50 or 1 to 100. And this one usually you use on environment as well, not really to the animal. Okay. So the pink thing that we talk about, City, is this thing called chlorhexidine. Okay. Chlorhexidine is under this very weird, weird sounding group of medication. Okay, but you can use chlorhexidine, diluted chlorhexidine on your animal. So if you have the pink solution, make sure you dilute it. If not, right, it will be too much. And if it's too thick and your pets lick it, they might be vomiting because of that. So make sure you dilute it to about 1% or less. Then you can actually use it on them. Okay, if you can't, you just use it directly, and then after that you rinse it off with water. Okay, you wash it directly with chlorhexidine. Usually the one that we get from the market is about 4%, and then after that leave it on like how I said just now, maybe 10 minutes, and then after that rinse it off. Make sure when you soak it with that 10 minutes, don't let them lick it. Okay, unless you actually use a much diluted chlorhexidine, then it's safe for them to lick. Okay, you can use things like halogen base like hypochlorites and even iodine. Okay, like iodine, the brown color iodine, that actually is a very good disinfectant as well. But usually we don't really use it on animals to prevent or to actually disinfect them. But if you don't have anything, this is a good disinfectant as well as iodine. Why we didn't use it? Because of the color. You don't want your dog paw always yellow in color, all right? If you use iodine, usually the povidone iodine that we have is really, really concentrated. So how do you know how much to dilute? It's very difficult because different povidone come with different percentage. So usually you mix it to the color of Chinese tea. That should be around the dilution that you can actually disinfect. It's very not scientific, but if you want a proper dilution, I think it's very difficult because we have to work on it every single one. All right. And soap-based thing like things that have benzoconium or even just the normal soap, it's actually good enough to actually wash off the virus. They just don't kill them, but they actually wash it off. If you don't have anything else, let's say you walk them and come back and you're worried because you saw some of the dogs that playing with him, come back, at least wash with soap and dry them. Okay? Any questions? Okay, I think there's some last thing that I really need to remind you guys of. Sorry, I'm slightly late. Always wash your own hand now. Make it a habit because you do not know that whether you are being, affected or not, because sometimes you go out for groceries and all that, you do not know whether you are carrying the virus or not. Okay, so make it a habit now that when you're preparing food for yourself and for the pets, Joey, can we have the next slide? Please wash your hand because you want to stay healthy around your pets, all right? Before and after touching or playing with your pet. Okay, now when you come home, if you go to work and all that, when you come home, don't snuggle with them right away. Treat them like your baby, treat them like your children. Do not hug and kiss them first, please. Run to your bathroom, change and clean yourself and take shower before you come and touch and play with them. Can you please do that? If everyone can do that, please put up a 99. If everyone understand what I'm talking about, thank you so much. Great. Before and after feeding your pet or handling your pet food or even prepare food for yourself, okay? Before you actually touch and clean, handling their bedding, their bed sheets, their cages and things and toys, whatsoever, please wash your hand as well. After cleaning your pets and your pet poo and pee, after cleaning them up, please wash your hand as well, even with soap. If you have chlorhexidine and all these other antiseptic soap, please use them as well, okay? Before preparing your own food and drink. And after removing all these soy clothes and shoes that when you come back from work or even, to the park. All right? Great. Very good. I think I've covered most of the things that I need to cover. Now I will want to open up for question and answer. All right. Great. Did you guys learn something at least? If yes, you say you must type in the chat, say smarter. Do you think you're slightly knowing a little bit more? Can bunnies get COVID too? Okay, there is no, hi Rohana, there is no there's no report that from bunny, I mean, the bunnies can actually get COVID. And most of the time we won't be too worried about it, is because bunny is actually in rodent family. So far, this rodent family has not reported with COVID at all at the moment. Okay, so we have different family, like we have feline family, we have canine family. So rabbits, rats, and all that are the rodents family. So at the moment, we don't have any report from bunnies. Okay, did I answer your question? Very good, thank you. So many people are smarter. Disinfectant, well, did I miss any? If I miss any of your question, please type it down as well. Mandy asked if pets sleep with owner, how often to change bed sheet? With COVID or without COVID? With COVID, you shouldn't sleep with your pet, okay? If without COVID, usually we do it weekly, but every day, serious? No, actually, I don't have, to be very frank, I don't have a real answer for it. It really depends on how your pet's actually your pet's lifestyle. Okay, whether she's a totally indoor pet. Let's say your cat is totally indoor and you let her sleep, you know, inside your room and on your bed all the time. Then it's not a concern whether they sleep with you or not. It's your own hygiene that, you know, how long that you want to change your bed sheets. Okay, so that's not a concern anymore. But if you yourself have COVID or any members in the family have COVID, then you must actually disinfect the toy, the pillow, and all that every single day. Okay, so if with COVID, that is what you need to do. All right, but for all the other reason, if your pet always go outside, you know, walk outside the park and whatnot, and then they come back and sleep with you, please make sure you wash your dog feet every day or disinfect your dog feet every day, because they do bring other viruses. Like yesterday, I've actually give a talk on zoonotic disease. There are some zoonotic disease like leptospirosis can actually comes to human by urine or this water on the roadside. So today and tomorrow, I think there will be a replay as well on the platform called Oh My Pet. It's a free class. You guys can actually go there, you know, and learn about zoonotic disease, okay? And I think some of you guys have attended it yesterday. All right. I'll give another 5 to 10 more minutes for you guys to ask questions, yeah? Okay, Minnie, I hope I answer your question. Is doggy or cat tissue advisable? Okay, Georgia. As a pet owner, you know, pet instructor and a vet, I don't think a lot of our doggy and cats like to wear shoes. But if they don't mind, it's a good thing. But if they mind, if they don't really like it, please do not use it, because they might cause other issue like other joint and ligaments issue if they don't walk it right with the shoe. Okay, so I wouldn't be too advisable for you to wear shoe unless they're very comfortable and they use it very well. Okay, so yeah, Georgia, I hope I answer your question. Indoor pets get mites. It's not really related to this class, but I'll still answer you. You can, because mites and all the other parasite can actually come to your shoe and your clothing and come to your house when you're coming back to your house, and they will find these holes because they're parasite. So they find a very suitable host like your cats and dog, then they just will jump on them and start replicate. All right. Oh, thank you, Joey, for putting this up. The zoonotic talk, Joey has put it in the chat room. please click it on Facebook on Oh My Pet. I think they will repeat it for today and tomorrow. Okay, for the zoonotic class. It's a very good class that I talk about all the other zoonotic disease like rabies and ringworm and sporotrichosis if you have interest in it. Okay. Any supplement, there's a lot of immune booster out there, so you can choose any one of it. You have yeast, you have things like these colostrum, you have things like all the other immune booster, they are things like EMG, it has too many. You can actually write down some immune booster. There will be a lot of suggestion. I can't tell you which one is good and bad because different supplements are actually how to say, are actually good for different pets, are suitable for different pets. Okay, so I'm sorry, you have to try it out to know that which one is most suitable for your pets. Okay, can we sanitize what? Yun post or put on clothes. What is yun post? Did I miss something? Should I Google it? Or you actually has a typo? Okay, I'm not sure about the Zoom session tomorrow. You probably have to click on the Facebook, click the link that Joey put up here. Great. Yeah, Georgia, most of them just freeze and don't want to walk. Immune booster and probiotic is not really the same, but some of the probiotic, they take it as immune booster. Okay. All the sanitizer that we use, okay, the sanitizer that we use, that we send it to you, is actually chlorhexidine based. Okay, chlorhexidine based. You can actually put on your dog fur and also the paw if you can, and you don't need to rinse it off. Okay, that there are these active ingredient there. You can cross check it to my post as well, my table just now. Joey, maybe we can help them. We can actually put the post up again so that they can take a photo of the category. You can actually take a photo of the category of that post and of that slide, and then check out each and every of that ingredient. Okay, can pet lick? For that concentration, is safe for the pets to lick. Right, this one. Yes, this is the one. You guys can take a photo of this one, and the one that on top is all the chemical, the chemical acids, alcohol, aldehydes. Those are the chemical category. The one down there is some of the what is this called, the brand name or of some sort under the category. Okay, great. Bunnies can use chlorhexidine as well, yes, but they are more sensitive on the licking, so it's good after you apply. Don't let them lick first when it's really wet, and it's good that leave it dry before you actually leave it without the collar or leave it. Okay, for cats and dogs the same. If you can actually use it and leave it dry at least for 10 minutes, because you have to leave it for 10 minutes before they can actually use to it. And the story of this sanitizer coming up is because we see too many of the human sanitizer poisoning in our practice, that we need to kind of develop these sanitizers. Okay, actually for the chemical on top is actually the same category. It's only the one on the left hand side, which is the category of what they take care of, is not in there. All right, thank you so much. Any more questions? Right, if everyone think is awesome, Is it awesome that you spend this 1 whole hour with me? Is it? I really hope it worth your time. And there are quite many of the video, the classes video that we used to do Facebook Live before in different topic, like how you take care of fearful dog, how to take care of puppies, how to understand cats body language, and how does cat feel most of the time, and what is the emergency things that you can look at, how to take care of your pet when they have heat stroke and all that. You can actually like our page on PetMedic and learn it from the recorded live that we have. We really hope that this seminar, this class benefit you. Yes. Okay, Georgia, let me clarify this, okay? So whatever the article from BBC or from CDC, they actually thinks that this collar, their fur, like how I tell, the virus can actually stay on in their nostril, their eye, their collar, their clothes, or their fur, okay? The virus can stay there. But it doesn't really affect the dogs and cats because of the lock and key concept that I'm telling you. So they don't really replicate and cause the dog and cats to be sick. Okay. So when you actually, that is why I teach you how you sanitize them before you bring to your vet if they are really, really sick. Okay. So what you need to do is that you can actually sanitize your collar and your clothing and all that with whatever sanitizer that I have told you, the chlorine base, the aldehyde base and all that. And then on your pet's body, do not use alcohol base, use the halogen base, or use chlorhexidine, or even soap water would be good enough to actually kind of like wash off the virus. Okay, great. If you put just the carrier of the virus, we don't call them, I don't know who this Acer is, but we don't call them carrier of the virus. Okay, no, I need to make it very clear to you guys. Dogs and cats are not carrier of the virus. No. Carrier means they carry it in their body and they're spreading it to other peoples and animals. That is called carrier. Dogs and cats are not carrier of COVID-19. Not. They just carry like how you carry on your water bottle and handphone and clothing. Okay? I hope I make myself very clear. Is that okay, Esther? Do I make you right? You can actually, after 10 minutes, if it is still dry, you can actually keep rubbing it to make it dry. Okay? Thank you so much. I think that's all from me now. You guys have stayed wonderfully and I won't, take too much of your time. Thank you so much. I'll see you guys in other classes. All right? Thank you. Goodbye. Thank you. Good night.